Hi, it's Dr. Centeno, and today we're going to talk about percutaneous scolioplasty, a brand new procedure that we've developed to help people with scoliosis. So scoliosis, as you probably already know, is a sideways curvature of the spine. So there are two main types of scoliosis. One is adolescent, and that's where you can see the curve here, but the bones still look intact and normal. Here you can see lots of bone spurs and changes in shapes of the bone, but you also have this S-shaped curve. So adolescent on the left, degenerative on the right. The most common surgery that's done is some sort of long rotted fusion, and you can generally straighten things if you've got adolescent scoliosis, but you can't really straighten things if you've got degenerative scoliosis. Now, what if we could use targeted injections of your own healing blood platelets or stem cells to help this condition? And that's percutaneous scolioplasty. We do precise injections of autologous biologics to try to tighten down and strengthen tissues that are under stress due to the curve, and then to treat all the areas that have problems that are causing pain, because it's usually not just one area, it's many. So for example, on this side of the curve, things are going to be stretched out. So we've got to treat damaged muscles and tendons from all that extra stretch. On this side of the curve, things are going to be compressed. So facet joints and areas where nerves come out can get compressed, and those need to be treated. So very selective targeted treatments based on where the issues are and on which side of the curve we're treating. So our focus is to inject all of those. In addition to that, to try to buttress the curve by injecting these intertransverse ligaments on this side and injecting the fascia on this side as well to try to buttress what the spine wants to do by going one direction. On the side there, we inject these intertransverse ligaments, which are in a place to actually help buttress that curve. And then the fascia that is on one side to help the rotation. And in order to do this, you really need an advanced imaging suite like this, where you can use X-ray and ultrasound guidance at the same time. Obviously, you need to have substantial training to do it as well. So this is an older woman, and we treat lots of young patients as well, but she had fairly severe scoliosis here. Really went from using a wheelchair and not being able to walk to now walking half mile at a time as a result of this procedure. So thanks so much for watching. Hopefully we can help you with your scoliosis without surgery.